All right. Just want to welcome everybody who is tuning in on Facebook or YouTube today for another recording of Pencil Leadership. Very excited for our guests today. A really interesting topic about how to overcome stress and anxiety by kind of tuning into our nervous system and our physiology. So we have Dr. Alice Kerby with us today. She's a doctor of physical therapy, a health consultant, a holistic health practitioner, and a somatic experiencing practitioner in training. She uses her decades of experience and training to focus on the stress response from an autonomic, nervous system and physiological perspective. She also helps her clients to identify areas where they feel stuck and provides a well-regulated and supportive environment for them to begin gently touching past trauma or overwhelm and heal these states through presence and awareness of the body and in the present moment. So she also specializes in working with sober and sober curious women who are seeking additional tools to manage stress, increase a sense of calm, and move forward in creating their lives. Dr. Kerby, welcome to the show today.
Thanks so much for having me.
No problem. Excited to dig into how to kind of heal trauma, anxiety, stress through looking kind of intrinsically at our nervous system and physiological system. So, but first I'd love to hear kind of a little bit about you, your story, and what got you doing what you do.
Sure. So I'm a doctor of physical therapy, as you mentioned. And before I actually went back to school to become a physical therapist when I was 30. So I started college at age 30. And so in my 20s, I kind of had this whole other life. I was doing a lot of traveling. I was a flight attendant for a while. And I did a lot of education with different natural healing modalities. I studied Chinese medicine, alternative medicine, polarity therapy. I lived in really beautiful places all over the world and studied different natural healing modalities. So when I decided to go back to school, is I really wanted, I was a massage therapist. Back then I had a small business that I had a practice. And I really wanted to broaden my scope of practice. So I decided like PT school seems like a good fit. I originally wanted to go to med school and I kind of did all that and was pre-med and took the MCAT and then just really got hit with this strong sense of like, this isn't it. I don't want to do this. So I took a year and thought about it. I always really loved neuroscience, so I thought about a PhD in neuro, but I really didn't want to do research. I wanted to be active and moving. So PT was a really good fit. I still get to be a doctor, which was important to me. So anyway, that kind of is my educational history.
Cool.
And now the work that I do, like I've kind of moved away from clinical practice. I still see just a few patients that I've been with for a long time and, they won't let me go, but it's great. I love working with them. So it's really nice. But like while I was finishing up my doctorate, I started noticing in my own life, I was really just developing an unhealthy relationship with alcohol. So I was I had a ton of stress and anxiety trying to finish my clinical rotations and just prepare for my board exams. And I really didn't have any tools or mechanisms to cope with it. So I was watching myself kind of use alcohol more and more like in a self-medicating type way to try to calm anxiety, which for anyone else who's tried that, it really doesn't work. It's kind of okay for a little while and then it really isn't. And so for me, after a point, it really wasn't. And I got sober and I quit drinking and that was a pretty big it's been great. It's definitely, my stress and anxiety is much, much better just from removing alcohol alone. That helped a lot. But around that same time, I got introduced to this modality of trauma healing called somatic experiencing. And I worked with my practitioner for about a year doing that, and then decided to go ahead and take the 3-year training to become a trauma practitioner and a somatic experiencing practitioner. So at this point, I have one more year left. So I'm still a practitioner in training, but it's amazing work, and it really combines my love of like different healing modalities, but also the nervous system, as well as it works with the physiology. And as a physical therapist, I have a pretty good breadth of knowledge of the body and of the brain and how the systems work. But this work really pulls it in a very different way. And it's been interesting to utilize this work like from my physical therapy lens and help people to to really move through some pretty intense stuff. And in the case with the sober women that I work with, to really give them alternative methods to manage stress and anxiety that I wish I'd had presented to me
Mm,
back when that was such an issue. Other than reaching for a drink. And,
yeah.
in some of the cases of, I do corporate work as well. And sometimes it's not alcohol that's the issue, but it's like workaholism
Yeah.
and I see this a lot with entrepreneurs as well. It's because when you have your own thing, it's like, there's always something to do.
Yep.
And I think there's a mindset that goes along with it of like, well, if I don't do this, I'm going to lose out. I'm not going to get ahead. Somebody else is going to come and like, I don't know, steal my own audience. These are all
Right.
thoughts I have regularly.
Right.
So I really get it. And so being able to kind of manage our own systems, like through this process, whether we're in the corporate world or whether we're in the entrepreneur world, um, and be able to touch back into our bodies a little bit more and
Mm,
recognize some of what's happening in our physiology, and just kind of not just relying on the information from our neocortex. It helps us to be much more present, which for me definitely helps me to serve my people better and my audience better, and be a better
yeah.
leader. But it calms us down to like
Mhm.
actually get into our physical bodies and like be present here. It's a easier state to go through life in. So
For sure.
yeah, that's in a nutshell
Oh,
sort
I
of my
love it. And I
story.
think it's so cool because so originally my background, athletic training.
Right.
So yeah, the same thing. Just it's amazing how the body works together. And if we're not paying attention to the whole body, but just part of it, like our physical instead of like our mental or like our somatic system, like how it can still throw us off. And so I think it's neat to dig into this more. So for those who might not know, like what exactly is like a somatic experience practitioner? What does that entail, and what do you hit on a lot?
Sure. So the somatic experiencing is it's a trademarked modality. It's
Mm,
was developed by Dr. Peter Levine. He's the author of Waking the Tiger and
okay.
multiple other books. He's a uh, pretty well known in the trauma field, and it's beautiful work. And so the training for it's a 3-year program. And so you have like a beginner year, intermediate, and then an advanced year. And essentially it's ways to work with trauma, ways to
Okay.
work with chronic stress and overwhelm. And
Okay.
so, yeah, you're really tapping into like how trauma gets stored in the physiology, how the autonomic nervous system is like always on board with these things. And
Mm,
so it heals trauma or chronic stress really by not necessarily having to go in and relive memories or even really know what happened or know what the story is, but
mm-hmm.
to really work with the physiological piece of like, how's your body responding like right now in the here and now as we're talking about X, Y, and Z. And it might
Yeah.
not even be the initial trauma. Maybe there was a trauma where you almost got attacked by a dog, or you did get
Mm,
attacked by a dog as a child. And so now as an adult, and maybe you don't even have a memory of that or a real conscious memory, but now as an adult, every time you see your neighbor's dog, who's maybe very, very small and non-threatening, you still have this, like a highly activated sympathetic nervous system response, which, triggers the fight or flight. So maybe
yeah.
you're kind of, I'm doing this pulling back and freeze motion, because that's what
Mm-hmm.
happens for a lot of people. And so we can work with what's happening for you now with that response, and actually going in and like touching some of those sensations that are happening in the body, and really being present with what's going on in the physiology and the nervous system as it's happening,
Okay. Yeah.
versus trying to like tell a story about it or get the cognitive brain involved. It's really just noticing what's going on in the body. And that allows for almost like doors to open, is really how I think
Okay.
about it. Where then like, as we become acquainted with our body, it's like it thaws out some of those places, or opens up doors or windows to some, areas of like darkness, or that we don't really want to deal with because it's so vulnerable or so
Yeah.
painful.
No, absolutely. So you're talking about might not even remember things that have happened or vaguely, but they can still cause us to have that response.
Yes.
And have those sensations, I think is what you said too.
Mm-hmm.
So what are some common sensations or feelings that people might have, and they might not realize that they are connected to the nervous system and a response like that?
Mm-hmm. Well, what happens for you when you get stressed out? Like, what happens in your body if you could think of a recent time when you're mildly stressed or activated?
Yeah, I guess I feel tense up here, and just kind of like on edge, like, okay, what I need to do, like, oh, okay, I got this. So yeah, kind of get wound up, I guess would be a way to say it.
Yeah, and maybe there's like some like an impulse kind of driving like I want to move, or
yeah.
so stuff like that. And then a lot of people talk about, tightness in their chest is a common symptom around stress and anxieties. But that sense, of like needing to do or needing to go, particularly as we are in these heightened and long lasting chronic stress patterns, where it's like our body never goes into a natural like settling cycle the way we're biologically programmed to. And so when there's this constant override of like, just for an example, like I'm stressed, I get up, I got to do this, I got that, I got the kids, I got the office, like we live these crazy lives. And so we never let our system actually calm back down. And so that kind of symptom that you described of this, like, okay, I got to go. It's like this, our muscles are sort of coiled and ready for action. But it may not have like an appropriate place to land, and maybe it does. Maybe like, okay, we have this interview, we're going to prepare for it. It's going to be great. At the end, I'm going to, take 5 minutes or 10 and relax and drink water, whatever. But if it's like, maybe I have 5 more calls after this,
right,
that's my day. And like, I never actually, at the end of the day, I'm like drinking 5 beers because I need to, relax for example.
I'm
not going to do that. But it's like, there's just we're not letting our systems actually do what they need to do. Or the way that animals in the wild act with stressful situations. They typically have this heightened stress response. Then there's a period of settling and discharge that happens naturally. And our bodies are designed the same way, but we tend to override a lot of our natural physiological and biological responses because of our neocortex and just because of the way, our society's set up, really.
Yeah. So how our society is set up, and kind of overriding that. So not getting out of that kind of fight or flight feeling. Is that what you're meaning by that?
Yes. Yeah. If we have like long-term chronic stress and we're constantly just riding that high of that, like,
for sure,
we're way up here, and so we never come back down. Like
what should that down look like? What's kind of the normal of the body in that down, or is it different for different people?
I mean, there's certainly variations of it, but like, for instance, animals in the wild, if you picture, an antelope running across the plains and then the lion's chasing them, and, and the animal's like sympathetic, he's in his flight mode, very appropriate, right? And these are appropriate responses for us too. If a big dog is coming at us, we better hope that sympathetic nervous system is on board. But then what you'll see in the wild, like maybe the lion goes away, he gets distracted, whatever, he's out of the scene. And then the antelope he'll do like, it's called a discharge. He'll do like a little bit of twitching. And so that we'll do that too sometimes. There's other forms of discharge. Yawning is even one, or sighing. Sometimes tears can be a discharge, but some kind of just giving your body and your system time to sort of let all of those stress hormones like come out of the body, settle down. It's called like an activation and then a settling cycle. So I keep doing these hand motions. And so it looks like just giving yourself time to kind of integrate and come back into your body versus like overriding and continuing to move forward with that heightened stress response. It's like if we almost get into an accident or someone cuts us off on the way to work, and then we don't, pull over for 5 minutes and rest. We're just like, no, I'm fine. And like, you keep going and then you go in and deal with your work day. And so you never give your body that chance to come down and do, maybe it's a little shaky, or maybe it's just letting your breath restore to normal.
No, that's so I tried to start implementing, because like I noticed that like response to the stress or anxiety or whatever. So I'll go like walk outside. And just kind of get away from and then my wife always makes fun of me, but like take really big deep breaths. And just exhale. And she's like, she'll like mimic me, and I'm like, hey, I'm taking care of it, don't worry. But so that's what I've been adding into kind of like, I guess, my routine, because to get rid of the buildup of the anxiety or stress, or just go. And it's okay, I got to take a small step back, reset, and then go again.
Definitely. And I think if you can get outside, that's one of my big things too, and look at any kind of nature, or even if it's just a tree or parks, or I live by the ocean, so I walk by, I'll just go out there and look at that sometimes. But that helps. I feel like nature really offers our systems a nice reset, as long as we're safe and all that. But
for sure. So is there, and I know, but for people who might not, is there a correlation between the nervous system and not having that kind of downward area, that discharge, and a physical issue problem that comes from that?
I mean, sure. Yeah. If we're running on like heightened stress all the
Yeah.
time. This is the area where I would like to get more education is just
Yeah.
around like the hormonal component of this.
Okay.
Cause I mean, I know there's like, when there's like long-term or repeated stimulation of cortisol, I think that's
Mm,
actually been linked to autoimmune diseases.
okay.
Robert Sapolsky has done a ton of research on this. I don't know if you've heard of him. He's a
I don't know
biologist.
if I have.
He's a wonderful writer too. He's actually like a pretty funny writer.
Nice.
He wrote a book years and years ago called Why Zebras Don't Get Ulcers. And he talks a lot
Huh.
about this stress response. It's a great book. And he's been going to Africa for decades, studying primates. He's like brought his family over there at one point.
Wow.
So he's got a lot of really neat work about like what chronic stress does on the physical body. And it's an area I'd like to do more study in, but I know there's some correlation between different types of autoimmune diseases, things like high blood pressure, of course. And I think even weight gain is linked to higher levels of cortisol. Like it's harder
Okay.
to lose weight when we're flooding our system with cortisol. I think depression and anxiety certainly will come with those things. If we're not really taking time to have human connection, first and foremost with ourselves and with our own bodies. And then again, like taking the time to really truly connect with another human in a relaxed sort of like implementing our social nervous system where we could just kind of enjoy communication and connection. If we're lacking those things, that can definitely lead to health issues.
Yeah. No, I think it's like, because I mean, you hear, oh yeah, I'm stressed, I'm carrying it in my shoulder, like in my neck or in my back, or and all that. And yeah, I think over time, it's just like too much of anything can turn bad for us. I mean, even of a good thing, if you're doing too much of it, can be overwhelmed. You can overdose on vitamins if
Definitely.
you take enough of them.
And
So
exercise even. There's like some really, this one PT I follow, he does a lot with like too much exercise and overtraining, which
like rhabdo mile out or rhabdo.
Which is interesting, right? Because you don't think like, oh, we're supposed to, but it really does speak to the fact that we need an ebb and flow in our lives. It's how our systems are designed, and it makes sense. I mean, we need sleep, so I'm sure we need, we need different types of rest.
For sure. So how can I mean, you talked about like implementing that social nervous system, like getting out, being in community a little bit. Are there other ways that you go about directing people when they're trying to work through this process of kind of the ups and downs of it that they can do to kind of get to that discharge easier?
There's definitely stuff to do. I'm actually doing a 4-week course right now, and I'm teaching the course is what I mean.
Nice.
But in the first week we work with, let me see if I have this handy. Give me 1 second. I may not, sorry. I have a pretty,
No, it's all right.
I have a diagram. I wasn't expecting to use it today, but these folders on my desk. Anyway, I won't show it, but yes, there's things that we can do. And so one of the first things, and what I really like to start a lot of my foundational work with that I'm teaching, is to just start noticing there's something called the window of tolerance, which is what my picture is of. And it's kind of when we're within this tolerable range within our nervous system. And so the goal really isn't to be this super relaxed Buddha all the time. I mean, maybe like if you want to really pursue that lifestyle, I think that's different than kind of how most of us exist in the modern world. But the goal is to be able to go through those ebbs and flows and to have kind of a well-regulated and resilient nervous system, so that we can, activate and settle. And so one of the the things that I like to have people start with is to sort of notice that window of tolerance. And so you can imagine this picture, it's like 2 horizontal lines here. And then above this one, that's where you're like in this really highly sympathetic state. And then below here is where you're really in that sort of the pathological parasympathetic state, which can be like freeze or depression, or even like leading into thanatosis or states like that. And so if we can just start to be aware when we really start tracking and getting outside of the window. So I'll have people be like, draw your window of tolerance, draw out a day, and notice like where you are in the day. Are you way up here the whole day? Like what causes you to start getting up there? And so to start noticing before we're like at a 10, notice when we're like at a 2 or 3, and then really pause and say like, okay, what's happening to my body right now? Like, what am I noticing? What sensations are going along with this? Am I sitting like this? Oh, interesting. Maybe let me just observe that and then see what happens as I observe it.
Interesting. I like that.
Yeah, so that's a big one. And then one of the biggest things that I talk about all the time is to start noticing your body when you feel good, or when you feel like
Mm,
pleasant, most like yourself, and really notice what sensations go along with that. And then that really helps us to start building our capacity to be in our bodies and to feel.
mm.
Because it's much more pleasant to do this when it's enjoyable. Like
Yeah.
when we're at the height of an anxiety attack or a panic attack, that's not really the time to start
Right.
noticing your body.
Yeah.
It's painful and people don't want to do it. It's the same with exercise. Nobody wants to start with the hardest thing that they hate. Like
Right.
no one's going to do it. But if you like going to take a walk, then that's great. Let's start there.
Yep.
So
No, I think
same.
that's key.
Yeah, it's really helpful. And it's fun too to like notice when you feel good and really like it's like
Yeah.
savoring a bite of chocolate cake. You're like, oh,
Oh, I do feel good. All right.
yeah, how's this
Yeah.
feel in my body? Yeah,
Yeah.
it's fun and enjoyable, and it really builds our capacity.
No, that's awesome. And you mentioned a couple times already the parasympathetic and sympathetic nerve systems. For those who might not know, could you elaborate a little bit on those?
Sure. Yeah. So the autonomic nervous system is this branch of our nervous system that where things happen automatically. And so and then there's two branches of the autonomic nervous system, or the A and S. And the sympathetic nervous system is more that fight or flight. So that's when our survival instincts kick in because we think we're going to die. And like
Mhm.
literally, this is what happens in our brain. So in that example earlier with the dog, even though cognitively we can know like that's a little poodle, it's not going to hurt me. If our sympathetic nervous system is kicked in and our survival responses are like dialed up to a 9 or 10 because we had a
Yeah.
previous incident with a dog, our body's reacting like we're in a life-threatening situation. So it's really interesting to note that because it's not
Yeah.
just like, oh, I'm stressed. It's like, no, I think I'm going to die. So I'm going to do whatever weird thing I need to do to like not have that happen, including like
Mm.
run and jump a fence or like kickbox the dog or whatever.
Right.
Don't hit your neighbor's dogs out
Right.
there, everyone.
Unless you have
Um,
to.
unless you have to. So that's the sympathetic nervous system. It's the fight or flight response. And we have, our blood kind of flows into our extremities so that we can
Hmm.
run or fight, or our pupils get like more dilated so we can focus in on whatever it is so we can get away. And then our
Yeah.
parasympathetic system is more the rest or digest. It's when we're more relaxed. We have more of those feel good hormones are running through our body, less cortisol. We have more blood flow to our digestion and to our internal organs. Um, yeah, I think that's it in a
Perfect. No, thank you.
nutshell.
Yeah, no, yeah. That was good. Some people might not know the difference
Yeah.
or what that was, so that's perfect. Um, so yeah, I think going like being able to, yeah, I like that window. I like that visual of like where are we on the scale
Mm-hmm.
throughout the day. I mean, it's like anything, like tracking what you're eating, if you're trying to do the calories, or if you're trying to exercise, like how much weight, tracking that, like being able to track how you're feeling or what responses you're having during the day. I think that's a really cool visual and simple one to kind of track.
Yes. Yeah. It makes it a little easier. And
Yeah.
again, it's kind of fun, I guess. It's sort
Yeah.
of fun to like, put a pen to paper and notice. It takes some of the like stress, I think, out of it. Um,
Yeah, which is good, right?
yeah, exactly.
You
That's
don't
the whole
add more
point.
into it.
I know.
So how is it the same process, the same kind of visualization when you're trying to deal with things from the past? I know like you mentioned like the imagery of like if you were getting attacked by a dog when you're younger and it now has played a part into your fears or your response now. Is it the same kind of path to overcome those previous traumas with it?
I mean, I think with trauma healing, it's really good to work with a practitioner. So I
Mm,
always like to preface with that.
yeah.
Yeah, and it can be, it could have been like a big major incident, or it could have been a smaller incident, but you're seeing it recur in your life. It's really helpful to have somebody kind of guide you through some of these practices. I continue to work with my practitioner every 2 weeks. It's really, really helpful.
For sure.
So I definitely would preface with that. I think there is something to be said about having awareness around what's happening,
Hmm.
especially if it is around like a habitual pattern that maybe is born of a traumatic incident. Like having some awareness of what's happening, what your responses are, and then seeing if you're able to like touch into your body and feel a little bit more, and maybe try a different response and see what that
Gotcha.
feels like. But it's definitely helpful to work with someone around.
Yeah. Perfect. No, yeah, I think that's true. Definitely seek out the help needed. There's nothing wrong with that at all. I think it's definitely beneficial.
Oh yeah.
Counseling, practitioner, whatever it is, whatever you're needing,
It's
to
great.
seek that. So for sure. Yeah, definitely it helped me when I sought counseling back in college. So yeah, it's a helpful tool for sure.
Yeah,
So
100%. I wish I'd had some counseling back in PT school.
right.
Probably
Uh,
would have made my life a lot easier.
Life was your counselor.
Yes. Beat me down.
Right. So I think going forward with it, I know you mentioned a little bit about society and how our society kind of hinders our ability to get in this kind of right ebb and flow. What do you think is the biggest hindrance in society? What do you think causes that?
That's a really good question. I mean, I think it's multifaceted.
Mm-hmm.
I think we still really have this kind of cling to the American dream that if we
Yeah.
work really hard, then we'll be able to retire, at some point and like have a house. And that's
Right.
really just not the reality anymore. Even with two income families, it's harder and harder to buy a house. Like college has skyrocketed. So like our whole paradigm has shifted. But I think we do tend to have this mentality of like more is better. We need to
Mm,
push really hard. We need to be working 60 and 80-hour weeks. And that's like the ticket to success. Which is, I mean, we're seeing more and more this just isn't true because you look at people who
right.
have that, and certainly some people are relaxed and happy and taking cruise vacations around the Caribbean, but then you also see other people who have a lot of major health problems in their 60s. There's a ton of like
True.
obesity, loneliness, depression. All of these things are really, really prevalent. So I think examining that, like what is the need to get up and push and work like hard to the point of where we don't allow ourselves like intermittent rest, like within our
Mm,
days, within our weeks, like take a half day on a Wednesday,
yeah.
if that's what you need. Like I like to take Wednesdays and hike in the morning, and that works really well for me
Nice.
to have like that break there. I frequently work
Yep.
on Saturdays because it's so crowded here. I don't want to go out Saturday. So I'm like, great. So I'll hike Wednesday, Friday and work Saturday. Which is kind of off topic. I don't
No, that's all right.
know. But I guess my point is like, it's if we can adapt our schedules a little bit to like to understand like what our own system's pacing is and like what our
Yeah.
own needs are and get away from some of that, which I think doesn't really answer your question, but more speaks to a solution for it.
Yeah.
That helps because it's just, I don't know, this idea that we're supposed to get up and like do a workout every day and like a 5 a.m. I don't know. And then I don't
Yeah.
know. It just doesn't work. And it really doesn't work for women. And this is a part of that hormonal piece too, is just the way that, we're on this 28-day cycle with our
Mm,
hormones. And so
right.
it's really good for women to just get to know like the different hormonal phases of your cycle. It's like, when do I have more testosterone? When do I have more estrogen? And like each phase, it's we are better suited for different tasks.
Yeah.
Like, yeah, some phases and like with the male hormonal cycle, it runs on a 24-hour clock, which is kind of how we're set up, where there's like a surge of testosterone in the morning.
Mm-hmm.
And this works too for women that are past menopause or premenstrual. They're again on this 24-hour clock. But for women, for a big chunk of our lives, we're also working on this 28-day cycle. And
Right.
so really getting some insight into like what's happening in our hormones, like throughout the 4 phases of that cycle, that's really beneficial of like how we can structure our work weeks and our work days. And
Mm.
some days are not the best to make big decisions. Some days are really good days to have meetings. And again, this isn't answering your question.
No, I love
Speaking
it though.
speaking
It's
more to the
great.
solution. It's a great
Yeah.
point.
Yeah.
This woman, Elisa Vitti, has done a lot of research around that, around the infradian cycle and the 28-day clock. And she's got some great information about like what hormones are doing what and what that means. And if you're a woman, definitely check that out.
Yeah. Yeah. I just think how the body's created to have these different phases during the day or through the cycle. And then, yeah, if we can like, it almost like if we can understand ourselves better, I think we've gotten so far away from understanding how our
Yeah.
body works and how it's supposed to work and the responses. And I think it's all shifted to, trying to, I don't know, it's almost like trying to please the masses with what our work ethic, like who are we like working for and the
Right.
end of the
Yeah.
day. So
Yeah. What do you think is the main, like a big driving factor for that? It's a good question.
yeah, it's almost like we're taught so much what the process is supposed to be. Like,
Mm-hmm.
we're supposed to do this and this and this and get a job and work and retire and all this. And then, but then who you're listening to is teaching you like what the outcome's supposed to be. So are you supposed to work 12 hours a day, come home, barely talk to your family, go to bed? Or what's more important? Like, is it the work-life balance? Like, I think a lot of it's with like just how we're taught.
Yeah.
But yeah, just the focus is more on almost results rather than like change or like care, I guess, with individuals or others, you know?
Yeah.
I don't know. It is a hard question, even thinking on it there. Like it's almost like we're focused too much on what others think of us and our results, what we're doing, and we're not remembering to take care of ourselves,
Right.
which then in turn hurts us in helping others and being able to give back to others. So it's like you said, multifaceted. There's so much that goes into it. But yeah, it's
a big question.
Yeah. And it's probably a lot deeper than what we have time for sure to get into.
Yeah, I will say, like, as an entrepreneur and having my own struggles with this entrepreneurial journey, because there's a lot that goes with it, you know, there really is. And there's high peaks, there's low peaks, but the more that I've been able to tap into my bodies and my like own, like sort of natural pacing, because I'm not like, I'm a hard worker and I can get really obsessed, but I've like, everything's so much easier when I like am in more of a flow state, when I take time to go hiking, when I like don't schedule back-to-back calls, when I get myself, 30 minutes in between, or it's just easier and it's better and I'm more effective at what I do. So it's a constant, like I have to remind myself of this, weekly almost of pacing. I like the concept of pacing. Like, what's my long-term game here? Like, how, and how am I setting my life up for myself? Is it so that I can work all the time? Because if I'm doing that now, I'm probably always going to do that. I don't know that I'll get to a point where all of a sudden I just shift and, maybe if I have a lot of money, but probably not. I think we build these patterns and we want to, we ride them out. So what we're building and establishing now as we're creating businesses and moving through this entrepreneurial journey is, it's important to look at, I think.
Yeah, no, I agree. Yeah, I think, and again, it just goes back to knowing yourself. How do you run best? Where is that flow state for you? What is that? Is it you just need a 20-minute break in the middle of the day? Is that good, or break it up even more? Yeah, so I think that's huge, just to know yourself and know your body, and kind of build kind of your life around that, or your schedule around that, and kind of see how that can help flourish and help things really grow a lot better.
Yeah. 100%.
Well, awesome. Well, Dr. Kerby, I appreciate you being on today. Before we go, I have a question I always ask the guests, and it has to do with pencil leadership. The fifth trait is that we're all created to leave a mark. And so at the end of the day, when everything is said and done for you here on Earth, what do you hope your mark is?
Oh boy, that's a big question too. I mean, honestly, my goal that I don't always say, because it's kind of goofy, is I would like to see like more people in their bodies, and I think people could take that different ways, but I know what I mean by it. And I'd love to like leave that mark on the world, is like more people who are able to like show up in their bodies like every day.
Cool.
And like,
I love it. Yeah, I think that, I mean, that would make, if people did that, I think we would see a huge change in culture and in the state of things for sure.
Yeah. I can feel my whole own like stomach just relax at the thought of that. I'm like,
yeah,
that sounds nice.
There's your ebb and flow there.
Exactly.
Like,
that's let me stay in that place for a little while. It seems relaxing to envision.
Well, awesome. Well, again, we appreciate it. Is there a place or where's the best place where people can connect with you and see what you're doing or get your help with things?
Sure. Thanks for asking. You can always check out my websites, Kerby Method Consulting. My last name is with an E, Kerby. I'm also pretty active on Facebook and Instagram. Facebook, I'm Alice Kerby. Instagram, DR as in Dr. Alice Kerby. And I do a lot of live education, mostly on Facebook, although I think I'm going to be doing more of that on Instagram. So if you want to hear me talk more about some of these techniques, offer some practices to help, with getting in your body and practicing some of the somatic work, I talk about it All the time.
Awesome. Yeah, guys. So definitely get connected with her on those platforms. Just keep learning. It's really good stuff. And knowing more about her body is huge. So, Dr. Kerby, thank you again for being on Pencil Leadership.
You're welcome. It was really fun. Thanks for having me.
No problem. All right, guys. If you like this episode, don't forget to share it. Let somebody else learn and make a difference in their life by sharing it. So subscribe, like, all that fun stuff. Thanks again for tuning in to Pencil Leadership. So let's go out and